Hello, my name's Sam, I'm 27 and I'm from Liverpool, and I've decided to document my experiences with having an acoustic neuroma. I was diagnosed in November of last year with a 3.5 cm acoustic neuroma. For those who don't know what an acoustic neuroma is, it's a type of brain tumour. It's a tumour on the acoustic nerve. I'll start from the beginning. Basically, in January of 2010 I had a really heavy cold and my hearing just cut out one day in my left ear. Very limited hearing in it, and whatever hearing I did have was very distorted. I had a lot of pain in the ear and a lot of tinnitus, really bad tinnitus. It's still got the tinnitus, and sometimes it flares up and it's really bad, and sometimes it's okay. Sometimes I have birds and stuff, and other times you barely notice it. I went to my doctor, and my doctor basically was like, oh yeah, it's just tinnitus, you've got it for the rest of your life now, you know, deal with it. And I wasn't happy that he basically dismissed the rest of my symptoms, such as the pain. So I changed doctor, and I saw the first doctor that I saw in that surgery said he thought maybe my Euston tube, I think it's called, I'm not quite sure, had basically blocked, or was not working properly because of the heavy cold, and that just needs to steam with some Albus-oil and stuff, and hopefully it will go back. 10 months later I had another really bad cold, and I went back to the same surgery but saw a different doctor, and she wasn't happy with the fact that my ear had not gone back to normal. I still had no hearing, was still getting really bad pain, still had loads of tinnitus. So she referred me to the ear, nose and throat specialist, and he was amazing. He sent me for an hearing test and then for an MRI scan, and oh my god, MRI scans, I don't know if anybody else has, like, obviously there's other people obviously that have had MRI scans, but they're just horrendous. So hats off to people who have to have them on a regular basis, and you know, to little kids, because they're not nice. It's not a nice experience having that. If anything, I knew something was wrong when I went for the scan, because after the 4th time that they scanned, they told me that they were going to then inject some dye, and they hadn't mentioned that previously. So I thought, oh, maybe they spotted something and they want to see it a bit more clearer, which obviously was the case. So I knew something wasn't quite right. And then when I went back on the 15th of November to get the results, it was just there on the specialist's computer screen. It was just my scan, my head with a big fat tumour in it. I did get upset. I did get a bit panicked, because you just don't expect it. It's not, you don't expect to go to the doctor, you know, worried about, you know, a cold and being all bunged up, to be told that you've actually got a brain tumour. But then afterwards I thought, do you know what, he could have said it was a lot worse. He could have said I had cancer, that I wouldn't live past, you know, a few months or whatever, but he didn't. And although there are a lot of complications that can come from having the operation, I'd rather that than be dead, because I actually quite like living. So you know, it's just inevitable. I'm going to have an operation, which is fine. I'm going to lose the hearing in my left ear, which is fair dues, because I can't hear much anything in that ear anyway. So if you do ever see me and you shout out to me, I'm not ignoring you, I just can't hear you. And I've also got numbness in the left hand side of my face. Like, it feels like when you've been to the dentist and you've had an anaesthetic and it's come around, and you know that you're being touched, but it's not very sensitive. I've literally got that, and I can feel it all around there, or not feel, I should say. I'm also getting sent for possible genetic testing for neurofibromatosis. I've been on YouTube and I can't actually find anybody else that's being sent for this. So if anybody has been sent for it, or is going to be sent for it, if you could let me know, that'd be great. I'm also going for a scan on my spine because they're worried about maybe other tumours growing on my spinal column. Again, I've not seen that on YouTube, so if anybody else has had that experience or is due to go through it, then please, again, get in touch. So that's pretty much it. I just thought I'd make a quick video. Probably make another video in a couple of weeks once I've been for the genetic testing. And then hopefully I'll keep making videos after the operation. Obviously with the facial paralysis, I am determined that if that does happen, it's not going to stay that way. So I'm going to document me getting my smile back, because it's not going to come back. Definitely not. And yeah, that's pretty much it. So if anybody else wants to get in touch and share their experiences or talk about things, then that'd be great, because you can feel a bit alone, like because it's just not one of the things that you talk about or you hear about very much. So yeah, so thank you for watching.